Welcome back. Today, the question we have is, what supplements, doc, can I take that are natural to help my peripheral neuropathy? Okay, so welcome back. If you're new here, I am Dr. Tinuade Olusegun, and I am the internal medicine doctor here at Angelic Lift. Hey, so you have peripheral neuropathy, or this annoying pain that can happen in your feet and in your hands, and usually loves to wake up at night, right? It keeps you up, it just starts throbbing. It's like, some people describe it as feels like Charlie horses. Some people describe it as burning sensation. Some people describe it as like, it's like pins and needles, right? You're just feeling that all night long and it keeps you up, right? You've rubbed everything on it, massaged it, put your feet in ice and warm, and you don't even know what to do anymore. And you are now asking, what can I do to get rid of this thing, or at least reduce it so I can get better sleep? Okay, so what is it? What is peripheral neuropathy? This is a condition that's very, very, very common in patients that have had diabetes for a long time. And the best way to explain it is, it's a damage of the nerves or inflammation of these nerves that are outside of your central nervous system. So you know how we have the central nervous system, we have the spinal cord, right? Well, the nerves that come out of that from your spine all and extend to your feet and your hands, they're the peripheral nerves. So these nerves, when they get damaged or irritated because of inflammation, because of like the sugars in our diet, because of toxins, they start to give signals that basically says, hey, I'm bothered, I'm not happy here, help me out, okay? And the way they do it is they give you numbness, they give you tingling, they give you burning sensation, and so on, okay? So now you're experiencing this, and it's because this diabetes went untreated for a long time, and now you're left with this problem. Well, a lot of doctors will just start treating you with medications like gabapentin. You might be on Lyrica for this. You might be on Cymbalta. We also use amitriptyline in rare cases. And some doctors would even prescribe you some topical anesthetic creams to apply on it just to kind of fake your brain out so you can get some sleep. Well, none of this treats the underlying issue, right? Because again, they're all band-aids because the nerve is still not being treated, right? So some patients have come to me and said, doctor, is there anything I can take that will actually really help this problem, that is not going to be damaging to my liver and my kidneys and all these other organs? And I said, yes, actually, there's plenty of research that shows a lot of different supplements that have been very, very helpful in helping peripheral neuropathy. But you have to be open-minded and you have to be willing to take a ton of vitamins, okay? This is not just one thing that's going to fix it. This is a ton of different vitamins that you will have to take every day that will help. But before you start buying a ton of vitamins, what is the one thing that I always tell my patients to do is your diet, okay? Well, if you're eating really healthy, eating a variety of fruits, vegetables, greens, roots, colorful rainbow on your plate every day, you're already probably absorbing some of these nutrients, okay? But I'm gonna just talk about them in a kind of like a list, so that if you do wanna enhance or buy some to try to help, then you know which ones that might help your neuropathy, okay? So the first one is vitamin A, okay? So as we know, a lot of patients get vitamin A from eating, things like beta carotene that's inside of carrots, for example. And, a lot of the B vitamins are also very, very helpful. And I'm going to list the B vitamins that we've shown that has been helpful, because a lot of patients buy B12. And yes, B12 is very, very important for your nerve function and a ton of other things, but it's not just B12 that we're after here, okay? The B complex vitamins are water-soluble vitamins that are very important for a ton of different body functions. And they're the type of vitamins that you cannot become toxic on by ingesting, because your body will just get rid of the ones you don't need in your urine. So I feel very comfortable telling patients to take B vitamins. So B1, for example, is thiamine. lots of studies have shown that this has been helpful for neuropathy. We have riboflavin, which is B2. We have niacin, which is B3. I love niacin because when you take a supplement that has niacin in it, hey, you're going to realize that you've taken it because it causes some tingling in your skin, like for a brief moment, and then you know that you've actually absorbed it. So I love it for that. It can make some people flush if they take it on empty stomach, so I always say take it with food. So niacin is one. Then we also have pantothenic acid, which is another B vitamin. We have B6, we have B7, which we talked about, which is biotin. We have B9, which is folic acid, and a lot of supplements that have B12 will have folic acid in it as well, so you most likely are taking both when you buy your B12. So those are the B vitamins that I focus on. So instead of buying them individually, I will have my patients buy a B complex. That's probably an activated B complex, which means that they've already methylated a lot of these B vitamins to allow them to be absorbed a little bit easier, and you will not have to worry about the absorption with intrinsic factor. Okay, so B vitamins are very important for peripheral neuropathy in general. So buy a B complex and you will be able to get it. Vitamin D3, okay? So we've talked in other videos how vitamin D is, a lot of people are deficient in vitamin D, and this is very, very important for patients with peripheral neuropathy. My goal is to get your blood work to is somewhere between 50 and 80, okay? When you are trying to treat this. So don't just fall for, oh, you're in the normal range where the doctor is saying that your vitamin D level is at 30 or so. Okay, that's not high enough. You want to get it into well into the middle of the range, because normal range is from 30 to about 100 on the blood work. So you want to get it somewhere between 50 and 80 to really get the benefit of this. Okay, so if you have to take a little bit more, but have your doctor monitoring your vitamin D level. Okay, that's one you can become toxic on if you take too much. All right, so vitamin E is also very helpful. We know vitamin E helps a lot of skin conditions, and peripheral neuropathy is not different, so it helps the nerves as well. So then we go into things like calcium, chromium, copper, iron. Okay, we do see some improvement by increasing the amount of these foods, these vitamins, and you can also just increase them by eating better. Okay. Magnesium is also one that we definitely see has been very helpful. Some of the benefit of this magnesium is also because it helps relax the muscles around these nerves, and so that relaxation also reduces the inflammation, and so maybe that's how it's helping the nerve. So magnesium is very helpful. We also find that patients that take multivitamins that have maybe trace amounts of manganese, molybdenum, phosphorus, potassium, as well as zinc can also help the peripheral neuropathy. Okay, so there are some clinical trials that I've also looked at a supplement called Alpha-Lipoic Acid. This is overall very helpful for the immune system, but it is also very helpful for the nerves. And you will see some studies on Acetyl-L-Carnitine, and of course taking omega-3 fatty acids. So anything that has to do with nerves, you will see fish oils, very, very helpful in that as well. So one area that you might not hear a lot of doctors talk about, and I'm going to say this is a secret, okay? So the secret here is that we can actually use a couple of ingredients inside the cannabis plant also to treat peripheral neuropathy. And a lot of patients in my practice know that this is like one of our secret weapons. So if you have peripheral neuropathy and you've added a lot of these vitamins that I've been talking about today, but you haven't explored this and you're in a state that allows for medical cannabis, it might be something to look into. So medical cannabis contains two cannabinoids called THC and CBD. That is not the only two ingredients in this plant. There's well over 80 different ones, okay? But we're just gonna talk about those two. They're the two most commonly known, but they are also the ones that has been shown to help patients with nerve pain, okay? So the way it works is that the THC part of the plant influences the pain perception, right? And also helps to modulate the immune function, while the CBD part of the plant actually helps reduce inflammation around the nerves and also relax the muscle. So think of it like now you have like a ibuprofen that's an anti-inflammatory. You have like what we call it, a muscle relaxer, right? At the same time, you also have something that's helping the pain. So like in one plant, you're getting like all this in one. Okay, so you can apply it topically. When you're doing cannabis, you don't have to smoke it. That's where some people also are misled. You don't have to smoke the plant. We can extract this important ingredient out of the plant, put it in a little cream, and apply it to your feet every night before you go to sleep, so that all of this is happening, this inflammation reduction, this muscle relaxation and all that, so you can get a good night's sleep and this nerve pain not waking you up. We also can eat it. So you've heard of people eating a gummy before bed, using the cannabis gummy. That can be very helpful, because part of the plant, the THC part of the plant also helps with sleep. So now you're getting that benefit as well. Okay, so you could eat it, you could rub it on, and some people also use it as an inhaler, where you just take 2 puffs and not have to smoke and still get the benefit of this plant. There is also a topical patch where you can just put a patch on and let it deliver a 50-50 ratio of the THC and CBD to you on a microdose throughout the day, maybe 12 hours a day, maybe even we have some that lasts up to 72 hours. And then you just take the patch off every 3 days. So those are things that you can do to help with the symptoms of peripheral neuropathy without taking a prescription medication. Okay, hope that has been helpful. If you're not in a state that has medical cannabis, some states have recreational cannabis, and you can definitely go to a dispensary and ask the question on this topic. But make sure you're getting what we call the 1-to-1 ratio, which is that 50-50 combination of the THC and CBD. We're not trying to get high off of the cannabis. This is medicinal use, and it does help, and it is a secret weapon that we've been successfully using in our practice to help our patients not have to suffer with this condition. So hope this has been helpful. If you have benefited from using medical cannabis to help your peripheral neuropathy, please mention in the section below so people can see that there are real people that are getting benefit from this plant. Also, if you've tried any of this combination of vitamins and it has helped you, let us know. If you've bought it and it hasn't helped, I would love to hear your comment. Maybe the issue is with the dosages. And if that's really the question I'm seeing in the question section, I might just make another video on how strong should we make these vitamins so that we can really get to the benefit of it. Okay? Hope that helped. I'll see you on the next one. Bye for now.